Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020. Number 112. A 35-year-old woman came to the family doctor with complaints of profuse menstruations that last up to 10 days. Gynecological examination shows that the uterine cervix is without changes, the uterus is in anterflexio, has normal size, is mobile and painless. The uterine appendages on the both sides are without peculiarities. The family doctor made the provisional diagnosis of abnormal uterine bleeding. What instrumental method of examination needs to be performed first to diagnose this? Pathology? A. Colposcopy. B. Laparoscopy. C. Transabdominal ultrasound. D. Transvaginal ultrasound. E. Culdoscopy. Transabdominal, pelvic, ultrasound is an imaging test used to examine organs in the pelvis. It can be applied to visualize the liver, gallbladder, kidneys, pancreas, small and large intestine, appendix, bladder, uterus, adnexa, spleen, stomach, aorta, and inferior vena cava. In the setting of obstetrics and gynecology, it is usually performed to evaluate for possible pelvic pathology or pregnancy in a less invasive manner. In the emergency department, it is most commonly utilized to evaluate for intrauterine pregnancy, cholelithiasis, intra-abdominal free fluid, abdominal aortic aneurysm, and hydronephrosis. Transvaginal ultrasound, endovaginal ultrasounds, is an imaging procedure to see the pelvic cavity and organs inside the pelvis, that include the cervix, uterus, fallopian tubes, and ovaries. The transducer is inserted inside the vagina. It provides a more detailed visual of the organs and the soft tissue inside the pelvic cavity than an abdominal ultrasound. Colposcopy is a test to find out whether there are abnormal cells on the cervix or vagina. They can be caused by certain types of human papillomavirus, HPV, that can turn into cervical cancer cells. Culdoscopy is an endoscopic procedure performed to examine the rectouterine pouch, the pouch of Douglas, and pelvic viscera by the introduction of a culdoscope through the posterior vaginal wall. The word culdoscopy is derived from the term cul-de-sac. Laparoscopy, keyhole surgery, minimally invasive surgery, is a type of surgical procedure to access the inside of the abdomen and pelvis without having to make large incisions in the skin. The surgeon makes one or more small incisions in the abdomen for inserting the laparoscope and a tube used to pump gas into the abdomen, that makes it easier for the surgeon to look around and operate. The answer is D. Transvaginal ultrasound.